Health organizations continue to struggle in their fight against Ebola in West Africa, including Doctors Without Borders.
At the moment, as MSF, we only have a capacity to work in the case management centers, and we don't have a capacity to go outside. The situation is quite difficult.
Another group, Samaritan's Purse, says it is pulling all non-essential personnel from Liberia due to security concerns. Two of the group's workers, Dr. Kent Brantley and Nancy Wright-Bull, contracted the virus and are undergoing treatment right now. Both have reportedly shown a slight improvement over the past 24 hours. The World Health Organization says more than 100 healthcare workers have contracted Ebola in West Africa. At least half of them have died. Health agencies around the world are on high alert, including the UK.
The issue is about the possibility of somebody who has contracted the disease in Africa getting sick here. It is not about the disease spreading in the UK, because we have, frankly, different standards of infection control procedure.
Governments from the UK to the United States to China are sending health alerts to local doctors about the warning signs of Ebola. The World Health Organization last updated its tally of the death toll in this outbreak 1 week ago. At that time, 672 people had died. In Nigeria, health officials are still monitoring those who came in contact with the Liberian man who died of the Ebola virus in Lagos. So far, none of those placed under surveillance has shown any Ebola symptoms, but officials say it's too early to tell if the virus has spread. CCTV's Deji Badmas reports.
This laboratory right inside the University of Lagos Teaching Hospital is now central to Nigeria's fight to prevent a possible spread of the deadly Ebola virus. It's one of two laboratories monitoring the 59 persons who authorities say came into direct contact with the Liberian man who died of Ebola in a private clinic in Lagos. The good news is that up to this moment, the laboratory is yet to report any positive result for any of those being monitored.
We've been meeting with the contacts based on the level of the contact they had, and we've been advising them on the very need for them to restrict their movement. And all of them have temperatures to monitor their body temperatures in the morning and in the evening. And then, of course, they all have phone contacts, and as well as our field surveillance officers monitoring the contacts.
Even though none of the contacts being monitored has yet shown any sign of the Ebola virus, Professor Milabu warns it's still not yet time to cheer.
Until we are over with the incubation period, because the virus has between 2 and 21 days when it shows up in an individual. So until we are through with that 21 days incubation period, before we can pronounce them to be free of the virus.
And should any of the contacts being monitored come down with a symptom of the virus?
Once they show symptoms, we have structures in place. We have the isolation ward, and we have all the teams, so they know what to do. So once they monitor and they notice there is viremia, because that's what we are really after, through temperature hike, so we have to move them to the clinic, take their blood, analyze the blood, and see what they are incubating.
Omilabu and his team in the laboratory here are hoping they would never get to that stage. But he says they're leaving nothing to chance. The next 2 weeks are surely very crucial for both the contacts and the country. This is the entrance to the hospital in question where the Liberian man died. We have actually been inside. We were not allowed to film inside. Nobody would accept to speak to us. As a matter of fact, security came and told us to leave the premises. But before now, we've been told that the place has been decontaminated and that it's going to remain shut down for about 2 or 3 weeks before it is reopened. But that seems not to be the case, because the hospital seems to be operating. When we went in there, we saw patients waiting to be attended to. We saw medical workers in there. Nothing at all, no sign at all to show that the place is under lock. Deji Badmos, CCTV, Lagos, Nigeria.